Welcome to our Freedom from Suffering Now blog. I'm Dr. Steve Grinstead. Today I want to talk about something that's very important, I believe, for effective chronic pain management, and that's knowing how to tell the difference between pain and suffering. And that was such an important part for me to learn in my early pain management, because for a long time, the first 2 years of my years of living with chronic pain, I was suffering. And for the past 30 years, I haven't had to suffer. Now, all pain incorporates what we call physiological or ascending pain symptoms and psychological, emotional, or what I call descending pain symptoms. The ascending pain symptoms come from the receptors in the body, whether it's in the back, it's in the head, it's in the hands, it's in the feet, and then it travels up through the spinal column up to an area of the brain called the thalamus. And from there, a signal gets sent to the frontal lobes that is a cognitive or a thinking response, and then to the limbic system, the back of the brain, the more primitive part of the brain, and there's an emotional response. It happens like this in a heartbeat. The problem is, though, when people live with chronic pain, this constant repetition of pain signals being processed in the brain eventually can be amplified. And instead of, oh man, this hurts, it can be, oh God, this is killing me. It's horrible. It's awful. It's terrible. And that, to me, is suffering. Now, pain definitely is inevitable in many cases, although in some cases we can stop the pain. However, it is always possible to stop the suffering. And I definitely believe that freedom from suffering is every individual's right, and I also believe it's their responsibility. They need to get into action. And dealing with the psychological, emotional components of the pain is very crucial. Unfortunately, a lot of the patients I've seen over the past 30 years have got in trouble by using things other than their appropriate pain management interventions like medication, supplementing medication with additional or extra doses of medication, or maybe alcohol, or maybe other even street drugs or marijuana, whatever it is, to deal with the psychological, emotional parts of the pain. This never ends well. Some of the things that happen for people can be either pseudo addiction or addiction, or in many cases continuing to use opioids over a long period of time, 6 months, a year, or longer. It can turn into opioid-induced hyperalgesic effect, which is a hypersensitivity of the pain system. To really put it simply, the medications you're taking for your pain are causing a lot of the pain symptoms you're experiencing. So I believe it's really important to help someone who is living with chronic pain understand that they need to address pain both biologically and psychologically, emotionally, as well as the social component. If you're seeing this video on YouTube, please go to the link below to the blog, which talks a little bit more in depth about this, and also refers to an article I wrote, Moving Beyond Anticipatory Pain. That's exactly what happens to a lot of people when they live with chronic pain for a long time. They anticipate suffering, and there's a way beyond that. I really want to offer people a message of hope that it is possible to have effective pain management and true freedom from suffering. Thank you for joining me, and I'm wishing everyone a happy holiday season.